Hi, I'm Dr. Jeffrey Antimarino from Blepharoplasties Plastic Surgery and Medi-Spa. Welcome to another version of, or another edition of our Facebook Live. Tonight we're going to talk about our latest platform here at Blepharoplasties. Ella and I have been working on it for the last several months, and she's been working closely with our web vendors. So starting tomorrow, you're going to see some changes to our website that's going to launch the platform, so it'll be more interactive. And I have our friend Angela back tonight to help me demonstrate some of what we're going to talk about. So tonight we're going to shed some light on a topic that is not very well discussed, something that all women will eventually go through. So it's been known as the change of life, and it's more commonly known as menopause. So tonight we want to talk about that, the changes that we see. And so we wanted to address it tonight and put it on our website because we find that it's something that we see a lot in the practice, and we want to offer some support to some of the patients that we have and any other woman who is going through it. So we'll kick it off tonight, and if you have any questions, if you yourself or you know somebody who's going through menopause and you want to talk about it or ask some questions, please feel free, and we'll go over it tonight.
What inspired the Menopause Makeover?
Ella's going through menopause right now, so this is what inspired it. So, but you know, in all honesty, it's been something that I've seen for the last several years. You know, me being in my mid-50s, Ella is just going into her 50s and is going through menopause. But what I've seen is a change in the patients that I have in the practice, and I started seeing this sort of common theme or thread of concerns that women in a certain age group started to present with. And when I started to really look at the demographics, these were concerns that I wasn't seeing in any other demographic in women, and I wasn't seeing them in any demographic in men. So it kind of related to more of the menopausal, premenopause, menopause, postmenopausal era. And so we thought we would talk about it. Ella and I have been talking about it for a while. The reason we got the idea is one night we were getting ready to go someplace, and Ella was talking to me about some of the changes that were going on. And this is a common theme where women would come in and say to me, you know, I don't know what's going on. I'm exercising the same. My diet habits are the same. But suddenly I can't fit in my clothes the same. My body's changing. I don't know what's going on. I've increased my workouts. I'm not eating as much. I'm eating healthier. Suddenly I can't control it. So again, another time in a woman's life where her body's taking on changes, and it's really nothing that she can do to control it. So that's what sort of inspired us to start looking at other things that women were concerned about. And so we wanted to talk about it tonight, the signs and symptoms, talking with Ella and other women. It was kind of a news flash to me. I always figured it was something that women talked about. They talk about PMS, they talk about pregnancies, they talk about breastfeeding, times after kids, how to raise kids. But suddenly menopause was sort of off the table, and the general theme for that is I think it's a time when women start to feel, maybe they start to feel a little bit older. They're not in control anymore. They're not as young as when they were having kids. And so this is a big change in their life. They're starting to have things that maybe they don't want to talk about, especially with their partners or their husbands. You know, we all know about most of the symptoms, especially as men: the hot flashes, the night sweats, changes in mood swings, irritability. So these are kind of things, but there are other things that change in the body habitus, where women, again, are not fitting in their clothing the same, being uncomfortable in certain clothing, being uncomfortable sitting, dryness, mucosal dryness. So, you know, all of a sudden the intimacy with their partners is not the same. And so it really weighs on a woman's conscience, and it starts to change how she feels about herself. And so, as most people know, our practice has always been about education. That's what we pride ourselves on. And so we thought, because of this, we did want to talk about it. We did want to put it out there. So if any woman is going through it who has been concerned, we wanted to shed light on that tonight. So that's sort of been the impetus of all this. Again, I see a lot of it in my practice. So we have brought in on our website, that again will launch tomorrow, sort of an interactive portion where you can kind of tap on a body part that you might be having issues with or multiple. It'll take you to a page, it'll give you some information about it. We've had Leslie Bonci, who is a nationally known and internationally known nutritionist who works with people all over the Pittsburgh area, but also all across the country, and even pro athletes, helping them fine-tune their diet to help them with changes in metabolism, which is one of the problems with menopause. We also had Dr. Frank DeFabo, who is a really well-known gynecologist in the Greensburg and Latrobe area. We've known him for years, who's really is the center of this in his practice, and he's weighed in and written some stuff that'll be on our website. And my best friend from medical school, Dr. John Baisley, who's a gynecologist in Wisconsin, who also helped us weigh in on mommy makeovers and also the Menopause Makeover. And so that's what we're calling the new platform, Menopause Makeovers. We're not trying to be all educational about everything there is to know about menopause, but we want to put it out there to at least start the conversation. And then hopefully this will, kind of spark the interest for you to talk to your primary care doctor, your internist, a wellness doc, or your gynecologist.
So really, like a mommy makeover is a combination of procedures or treatments for women that are post-pregnancy. A menopause makeover is the same idea, that it's a combination, it can be a combination of procedures or treatments to treat the aging woman and her body, her concerns.
Because again, we put it out there because the women that have come to see me still want to look good. They still want to be their best. They're noticing some changes, things that they cannot control, again, through diet and exercise like they have all the years up to now. So what we're seeing is patients asking for help. What can we do? What combinations can we put together? What can they do to make themselves the best in their mind and sort of help them sort of redefine what they feel to be their beauty, their look, and their shape. And so what we find is that some of the most common problems that we're seeing, let's see if we can start from the top. Angela will help me. But at this time frame, so again, we're talking about ladies in their late 40s, maybe as early as 45, but most of them are in their late 40s through late 50s. And the biggest change comes in the skin. So we talked about on this program many times before that women are already kind of in a better or worse situation than men because the dermis of their skin is thinner than a man's. They've been bathed in hormones such as progesterone and estrogen over the years. So the woman's skin ages quicker and thins, so women start to age a little bit quicker than men. So in this time frame, again, a time of great hormonal shifts, we're starting to see changes not only in texture, but also the glow of a woman's skin. So a lot of women will come in and say, I just don't look bright, I don't have that youthful look anymore. And they describe it as sallow or tired looking. So we see changes in the skin. We're seeing changes in the facial structure. So these areas that on Angela you can see are nice and full, they've got that full cheek. Now things start to change. As we age, both men and women, we start to lose some of that volume in our face. The fatty tissue that was there in our youthful years is now starting to go away. The integrity or the tone of the tissue is now also starting to soften. So the attachments of the soft tissue to the underlying bone is now not as tight. So things start to shift down and forward. So we start to see this deepening of the nasolabial fold. We start to see some fullness here, which we call jowling. The line that we start to see here is called a marionette line. We lose volume in our cheeks. Our lid to cheek junction now elongates, so we start to look longer in the face. Things start to shift downward. The neck now is really the most common thing that brings men and women, but in this case all the women that come in, always talk about the extra skin in the neck area. The one thing that women really hate is not only that gobble here, but also the horizontal lines of the neck. Now remember, we've talked about sun care or skin care in the past. We're trying to really reduce the amount of sun damage. But now you have ladies in their late 40s, 50s, and early 60s now that have had all those years of sun damage compounding with the fact that the skin is thinning, so we're seeing a lot of sun damage, and that also helps age the skin. And so now we're starting to lose that glow of the skin because of also sun damage. So the areas that we see it, lower part of the neck, we see a lot of pigment changes, discoloration. This area here is called the décolleté. She shows it off nicely in her sports bra, but as women over the years of being out on the beach, at the pool, this area starts to thin. You start to get some different pigments. You start to get some of the sort of those age spots. The skin starts to get crepey and thin, and so women complain that they now see these vertical lines in the skin, mostly on the lower part of the décolleté and in between the breasts. So they're wanting to find out, what can we do to help bolster that? What can we do to change our skin, change the fullness of our face? How do we change all this so that we look more youthful and get that back? So that's sort of on the top to here. The other thing that I've been seeing a number of years now, and it's been kind of interesting for me as somebody who's done liposuction since for the last 20 years in private practice, is ladies are coming in now saying, you know, I don't get it, I'm just, you know, I feel uncomfortable, I want to talk about the fullness of my abdomen, my belly. And so it's kind of changed where now when I sit down, I'm uncomfortable. It feels like everything's pushed up underneath my ribs. It's hard for me to breathe, I don't feel comfortable sitting upright. And so I saw this over and over and over. So when I would examine all of these women, when I examined their abdomens, always in the top part of the belly, the fatty tissue here has become more fibrous, so it's more firm. So if you feel the fatty tissue down in the lower part of the abdomen, it stays soft, but this part up here has now become more fibrous. So when you sit down and this part kind of creases and rolls with you, what doesn't is this fatty tissue here. And I have seen patients try. I've worked with some of them to say, okay, well, let's get you with somebody, let's get you a trainer, we'll see what we can do from a non-surgical standpoint. Diet and exercise hasn't really been very effective. What has been effective is liposuction. So all of the patients that I've taken to the operating room, I can reduce all of this, but I can tell you when I aspirate it, this fatty tissue comes out as slightly different in texture, slightly different in color than the tissue that's coming out here and on the hips. So that's one of the biggest things that I've seen over the last several years. The interesting thing is now I have patients who will come in, I see on my schedule that they want to come in and talking about liposuction. I look at their age, I come in and start saying, what can I help you with today? And a lot of them will start talking about that. My body habitus has changed, I feel this fullness, and I said it kind of pushes up underneath your ribs when you're sitting down, and all of them look at me like, you know, I'm some type of magician. It's exactly, how do you know that? It's because that's one of the most common things I'm seeing, and I'm not seeing it in women at any other age group except for this kind of perimenopausal age group. So it's there, it's something I see a lot of. I never see it in men, so this is something that is really part of menopause. So other areas of lipodystrophy, I'm seeing patients, you know, having a larger deposits of fatty tissue in their thighs, sometimes up in the back of the arms, so arms are getting bigger. The other most common place is right under the bra strap. I mean, if you know, the women that are listening are probably shaking their heads, yes, that they understand, but ladies always want to talk about the upper back fat. It's really unsightly. It sticks out below the bra. It's hard to wear certain clothing because you can't disguise it or camouflage it. So that's one of the topics that they want to talk about. I also find that many of the women are having that. It's accentuated because their bras are too tight. One of the things that happens over time is that women start to lose volume in their breasts. We've talked about it many times before, especially in the upper part of the breast. So the breasts look like they're sagging just because the distance between the upper part of the chest at the top of the sternum to the nipple is elongated, and the breasts start to hang a little bit. So now women are using their bras to sort of lift their breasts up, and they have to use a really tight band around their chest wall to help hold the breasts in place. And that is accentuating what's called the back fat, because now you're squeezing that tissue to the same way that you get the muffin top over your pants. You're now getting this sort of muffin below the bra strap. So This is something that are really common and something that we take care of.
What are some of the non-surgical, you talked about the face, non-surgical treatments for adding volume? Is that something you would suggest you start with if that's a concern?
The biggest thing I can tell you is the consultation for any patient is key, but especially in this group of patients, because I need to get on the same page with them. So it's very key that we talk about what the woman's goals are, what her expectations are. Does she want to have surgery? Is she not ready for surgery? And so we can start with simple things, just as skincare. So I have patients see my esthetician. She goes through a skin analysis. We start looking at what type of skin care product she's on now, the patient's on now. What can we do to help rejuvenate that youthful glow to her skin? It's amazing that we had Leslie Fletcher from California come out and do some teaching with both Ashley and Pam, our injectors, about some new techniques. We were all talking about the changes in dermal fillers over the past really 6 to 10 years, and what the techniques are now. It used to be we were using dermal fillers to fill in lines and to help with this fold here, maybe the fold here. And now we're doing dermal fillers in different ways, different techniques to help lift and restore, and really not just to fill in defects, but really to restore that anatomy and pull things back into position. So that's been very helpful. So again, that may be an option, is really to do some dermal fillers. Fat transfers to the face are always something that we can talk about as well. Again, you can use volume to restore that volume that's sort of gone away over the years. The other nice thing about fat transfers is that when you use small amounts in the superficial area, sometimes ladies have very thin skin, and it varies amongst the women. So sometimes putting in a very thin layers of fat transfers underneath the skin can help bolster the skin and actually restore some of the glow that way. So I've been very impressed with that. I've been putting it above the upper lip to help with those lines that women develop. Again, I say women because you don't see it very often in men, but men can certainly get them as well. But these lines around the mouth that patients hate, so sometimes putting in some very thin layer of fat around those areas can help give you some more volume that's been lost over the years. So especially dermal fillers. Now, as we've talked about, and you've seen us talk about all the devices that we've now added to our Bellissimo Aesthetic Center, we have a Subnovi, which is a plasma pen that can treat the outer part of the skin, the crepiness of the skin. We can go over lines and etch different things on the skin to help plump that skin and stimulate the dermis below. We've added our Vivace machine, which we've talked about, and which has now been replaced by the Virtue. So we had is basically a similar device. It's microneedling and radio frequency. So this is to really treat the mid-dermis. So you have all these little needles that are just very fine tip needles, penetrate down into the dermis of the skin, then it releases a very small dose of a radio wave that helps heat the dermis. So it makes the dermis repair itself, bolster it, tighten it a little bit. And we've been doing that, and we've been adding my CO2 laser, which is over here to my right, to really treat the superficial dermis to the epidermis. So again, now we're treating not only the texture of the skin, getting rid of some of those areas of sun damage, but we're also treating down into the dermis, treating that area between the superficial part of the skin and the mid-dermis where the Virtue machine has treated. So again, we're plumping the skin that way. So some of these things we've really been able to change the look of the skin, the feel of the skin, the tightness of the skin, get rid of some of that crepey skin. The areas around the lower part of the neck, we've been doing the Virtue and CO2 laser. We're now starting to treat the décolleté area as well. Again, trying to get rid of some of that sun damage, bolster that dermis of that skin. So we really want to treat that without, there's really no good surgical way to treat that. But we want to try to soften those lines, those vertical lines that women are getting on the lower part of their chest and between the breasts. So that's sort of the non-surgical way to treat the facial complaints. the nice thing about that is most of the time it's very limited downtime, whether it's a couple of days to maybe a week.
How do you think this platform should be utilized for, it's not for everyone, but for women who choose to address areas?
Right, again, we want it to be used as an educational tool. So what I find is a lot of ladies that they come to see me, and the majority of my patients are women, but they come in, and I think a lot of times women have this sort of isolated feeling where they feel like what they're going through, they're the only ones. And so we want to start putting it out there so women, number one, the anxiety goes away because there's safety in numbers. When you find that you're not the only one complaining or experiencing hot flashes, changes in mood, not understanding why, changes in mucosal lubrication, things again that you don't want to talk about, you feel maybe embarrassed about. Now it's out there, it's on the website, you can see, you're like, maybe this pertains to me. I understand that there's lots of women like me, and so now I can maybe go out and feel more comfortable talking to somebody about it, talking to a nutritionist, talking to your gynecologist, talking to your primary care physician. There's different things that you can do from their standpoint. Make sure that your blood work is normal. Make sure that your thyroid is normal, your calcium levels, vitamin D levels. So it kind of, hopefully, patients are going to use this as a means to saying, you know what, this is a time of change in my life. In the past, it's always been sort of this negative connotation that's a sign of getting older. Yeah, but we get older every day. So we want this so that women can take control of their lives again, take care of it, get back on track of taking care of yourself now and doing something for yourself. So we put together these combinations of procedures. Again, not so much that we're not saying, hey, listen, you're in menopause, you should do this. That's not the point of this. The point of this is to let you know that this is what other women are seeing, and that when they ask, what can you do for it, we can present it to you. Doesn't mean you have to do anything, and most patients will know when I'm in a consultation, I always tell them there's no obligation. All we're doing is trading information. I want those patients to tell me what's bothering them. Let me take a look at it, and then I tell them, in my opinion, this is what you can do. This is what I can do for you if you choose to do it. You don't have to. So you've heard me say that about breast reconstruction. It's not that I want every woman to have a breast reconstruction, but the information should be out there for you to choose what's best for you. And same thing with the menopause. It's not for everybody, but the education should be for everybody. And that's why we have gynecologists and Leslie Bonchi talking about nutrition, things that we may not know. I don't want my patients randomly surfing the internet or social media. There's so much stuff that's out there that's not even policed. There's no one looking at it telling you what's real or not real. So you have to be careful. And so my point of this is we can get you to people that are professionals that can give you that information. So use it for what it is. Again, it's on the internet and on social media, but we want that to inspire you to go to an expert and find out the real information.
Valerie writes, hi, I had liposuction in my belly area. After a few years, it all came back to having that same full feeling when I sit down.
Yeah, and so that's one of the things when the hormonal issue, it may come back. I haven't seen it very often. It can do that though, and that again, you're looking at hormonal fluxes. So I haven't seen it very often, Valerie, so I feel bad that it happened to you, but it can happen. Remember, liposuction is only a tool. It helps get rid of the fat that's there. It doesn't get rid of all the fat that's there. It basically contours the fat that's in that area down to a normal level. Now, the fat that remains behind can also gain weight. It can also lose weight. So that's why it's not an end-all cure, but it is a tool to help fight that. But for most women, it's really just one time of the liposuction. But again, we would talk about there is a chance that you might need a touch-up liposuction in the future. I just haven't found anything that really works as well.
Wendy wants to know, are you completely under during liposuction, and what type of sedation? And is there downtime with liposuction?
So liposuction, depending upon where I do the liposuction. When I do liposuction in the facial area or under the chin in the submental area and really try to define that jawline, a lot of times I can do that under sedation. When I start doing it in the belly, the hips, the arms, the back, I put patients to completely asleep, or I have an anesthesiologist put them completely to sleep, because I'm going to put you in different positions on the table. So my patients go completely to sleep. That way the anesthesiologist can control the airway, give you the anesthesia that I need to keep you comfortable, so that I can really attack the areas that we need to attack.
What about the belly?
Again, because of the area I really want to attack, I have patients completely under anesthesia. So general anesthesia for that, especially in the menopausal woman, when you have that a little bit more fibrous, it's a little bit more difficult to get that tissue out or aspirated. So I want patients to be completely comfortable, not feeling any pain, and so then I can get to do what I get to do. So there are different modalities, and this is a question that I get asked a lot in inquiries. You know, what type of liposuction do I use? There's laser assisted, there's ultrasound assisted, Vaser, I use a power assisted, there's just straight liposuction. Realistically, it really depends upon the surgeon and the skill level and experience level of the surgeon. All of those modalities help the surgeon aspirate the fat. I know people back in California, in fact, you know, my mentor back there, you've heard me talk about him, he uses straight liposuction. So there's no vibration of the cannula like the one I use, there's no ultrasonic, he uses straight liposuction. He gets excellent results. Some surgeons feel better with the ultrasound assisted, some feel better with the laser assisted. It really depends on what the surgeon's experience level is. I've been using the power assisted now for almost 6 years. I've done ultrasonic and ultrasound assisted. They all work well. My results haven't changed just because I changed modalities. So when you're doing it, remember, watch for the advertising of, you know, this is the best way to do it. It really isn't the best way. It's the best surgeon or the most experienced surgeon is going to get the best results no matter what modality they use.
What do you have to do post-surgery? Are you wearing a garment?
For liposuction, so liposuction is nice because it's the least downtime. The incisions are only about 4 millimeters, you know, about this long in length in certain areas of the body. I use compression for about the first 3 to 4 weeks. Most patients are back to work within several days. Almost all of my patients are back to all of their exercising within about 1 to 2 weeks. So it's a very quick turnaround time because there's no dissection. So you have some swelling and a little bit of bruising for the first week to 2 weeks, and then that just resolves. The swelling will linger for a little bit longer, but you're going to start seeing some changes over the first few weeks. The final results of liposuction are about 8 to 9 months after the surgery.
If you had liposuction, as the patient asked, and you saw fat gathering in the upper part of your abdomen, would you suggest they come back, they could get another liposuction procedure?
Yeah, so if I saw them back, I would probably need to have a touch-up liposuction to go back and take some more and thin it again. Again, thin it down and contour it so it matches the rest of the belly.
You talked about a fat transfer. Is the fat taken when you do liposuction to areas of concern?
Right, so what we love to call fat grafting now in plastic surgery is repurposing the fat. So you take it from an area you don't want it and you put it in an area that you do want it. So that's become very popular to fill in the upper part of the breast, the face, so areas where there might be some contour deformities. So you can use all of the fat you aspirate, you can use part of the fat that you aspirate, and so that gives you an opportunity to do some fat grafting with the liposuction.
Fat grafting is done breast?
So most common areas that we talk about are, of course, the BBL or the Brazilian butt lift. So really adding some fat to the buttock area for better projection. You can do fat transfers to the breast and also to the face. Those are the most common areas. Most of the time when patients come to talk to me about fat grafting for breast augmentation, it usually takes 2 to 3 visits to do that for breast augmentation. So I usually tell them the best way to do it is really to do a breast implant. You can use fat grafting on top of that to fill in. So a lot of ladies that don't have great cleavage, or they want more cleavage, or want more fullness than even what the implant can give them, you can actually do fat grafting in those areas at the same time as the breast augmentation. So I just want to say thank you for everybody that tuned in about the Menopause Makeover. Again, our launch on the website is tomorrow, so please check it out. Our web vendors, these young ladies, have been working very hard for the last several weeks with Ella to get that ready for you. And so if you have any questions, please feel free to give us a call. You can also email us and come to us through Instagram and our website, so bellissimoplasticsurgery.com, and we'll be back again next month.